everyone, welcome back to my channel. Today's video is going to be pretty exciting. I'm excited to talk about and get more comfortable talking about our vaginas. Okay, I am seeing an increase in the amount of patients I see coming in, basically telling me that something's off down there and, what are they supposed to do? And I just want to give a disclaimer because I did read a few comments on some of my previous videos with people having concerns about, some of the treatments that I recommend or just some of the practices that I recommend. And, some people not agreeing with them or saying, this doesn't work or is this evidence-based? 99% of the things that I tell you will be evidence-based, but I also want to let you know that me coming from a midwifery background, I will always lean on the side of holistic care, preventative care, and natural remedies as well, because I truly believe in them and I truly believe that prevention is better than treatment. So although I will definitely advocate for pharmaceuticals when necessary, just know that with that, I will always talk about things that you can do to prevent certain situations, okay? So without further ado, if you want to know how to best take care of and ensure that you keep everything down there in balance, then please continue to watch. So we're going to be talking about two of the most common vaginal infections that we see today. One being bacterial vaginosis and the other being candidiasis, vulvovaginal candidiasis, or in better terms, or most known as yeast infection. Okay, so the first one, BV, or bacterial vaginosis, or even acute vaginitis, is the most common vaginal infection in the US for women ages 15 to 44. What is BV? BV is basically a disruption of your vaginal flora with an overgrowth of anaerobic bacteria. And anaerobic bacteria is basically bacteria that doesn't need oxygen to survive. It's bad bacteria, basically. So your pH balance gets thrown off, and because of that overgrowth of bad bacteria, you lose a lot of your good bacteria, and now, we're no longer in balance. So when it comes to the types of bacteria, there are different strains of bacteria that can throw you off in regards to bacterial vaginosis. So some of the more common ones are Gardnerella vaginalis, Uroplasma, Mycoplasma, and these are very important to know because you can come in and say, hey, I get this all the time. I know I got BV, just give me the flagyl. I already know what I need to treat it. And I always say, hold on. Let's not just, jump the gun and do that. I always like to take a vaginal specimen and send it out to the lab because I don't know what specific strain of bacteria could be causing the bacterial vaginosis. And with that being said, I would need a specific antibiotic to treat that specific strain. So if I just give you, the general antibiotic, sometimes the bacteria is resistant to that treatment. And I'll definitely talk a little bit more about that in a second. I do want to let you guys know that bacterial vaginosis is not a sexually transmitted disease or infection. So although the act of having sex can throw off your pH balance, it's not an infection caused by sex. So what are some of the signs and symptoms? Sometimes you can be asymptomatic and you don't notice anything different, and you could just be going for your regular, yearly well woman exam. And when we do, a specimen, it can come back and say that you have it. So just know that you can be asymptomatic. But more commonly, the symptoms that I see is an increase in vaginal discharge that will either look very thin, grayish, could be a little yellowish or whitish, but it's more thin and runny. And it usually has an overwhelming malodorous smell. So you might come in saying that you smell like a fish market. And automatically in my head, that's the first thing that I'm thinking. If most people say that they smell like fishy. So usually I will take a vaginal specimen. Well, I always do a vaginal exam with a speculum and look. And most of the time, I can sometimes diagnose based on what I see. But sometimes it's a little bit more tricky. So what I would do is I would take a vaginal specimen and I'll put some potassium hydroxide or KOH on the specimen. And then I'll do something called a whiff test, where I would just kind of like run the Q-tip past my nose, and if I smell an increase of like an amine fishy smell, like if it heightens the fishy smell or I smell like this amine smell, then that would be a positive whiff test, and I could go ahead and treat based on that. Also, you can also test the pH balance of the specimen as well, because women, we normally are more acidic. Our pH, our vaginal pH is usually less than 4.5. So if we see anything higher than that, then we know that the pH balance is thrown off. And just to keep in mind, men are alkaline, so they have a higher pH balance. So as you can tell, the act of having sex itself, having those two different pH balances can sometimes throw it off. But more importantly, I would send the vaginal specimen to the lab to then be, evaluated under the microscope to see the specific bacteria. And then we would go from there. I am very leery about doing, giving treatment based off of symptoms, but sometimes if a patient is just having, like, if the symptoms are just clear as day, the thin, white, fishy odor, then I would give them the basic antibiotic, but I will still send it out because sometimes I would have to follow up with a different antibiotic. So most of the time we do treat with metronidazole or flagyl. But there are also strains that need to be treated with clindamycin or azithromycin, and these you can only get from your healthcare provider in the form of a prescription. So orally, you would take the medication for 7 days daily, and I always advise against drinking alcohol when taking antibiotics, especially metronidazole, because it can cause a disulfiram effect, which is basically where you can experience vomiting or flushing. So just keep that in mind. And some other side effects are like a metallic taste in the mouth, nausea, headache, things like that. Or it can even turn your urine like a darker color. So in regards to preventative care, I recommend to all of my patients to add a probiotic to their daily vitamin intake. So a probiotic for vaginal health specifically. So this vitamin will basically feed your vaginal flora and your gut with healthy bacteria, specifically like lactobacilli, which you need to ward off bad bacteria. So that is like all across the board. I recommend that to everyone. So moving along to vulvovaginal candidiasis, or better known as a yeast infection. So what is this infection? So this is basically what it sounds like. It's an inflammation of the vulvovaginal area or the vaginal canal because of the increase of the organism Candida, which is yeast, and basically it disrupts the epithelial tissue in the vaginal area. It's the second most common vaginal infection, of course BV being the first, but this one is caused from the fungus Candida. So that's the main difference, and 75% of women will experience a yeast infection at some point in their lives. So you are not alone. This is not something to be embarrassed about at all. Our vaginas are sensitive, and we just have to be mindful. And when we do throw off the pH, it's very important for us to evaluate the things that we're doing around that time to see if they are directly connected to why you're experiencing it. Factors that put you at increased risk for yeast infections are pregnancy, reproductive age, uncontrolled diabetes, immunosuppressive disorders, frequent intercourse, antibiotic use, or a high dose of corticosteroid use. So you hear I said antibiotic use. So one side effect of taking medication for BV would be a yeast infection to form. So most of the time, if I'm giving a BV medication, I will follow that up and just prescribe a yeast infection medication as well. So some signs and symptoms of a yeast infection would be definitely vaginal or vulvovaginal. And when I say vulvovaginal or your vulva, that's all your external structures out there. So your clitoris, the lips or the labia, all of that area, and the vaginal opening or the introitus. Irritation is number one. You will definitely, more times than none, see a thick, white, clumpy, almost like a curdy cottage cheese-like discharge. It will have like a yeast smell as well, but it will not smell like fishy or really malodorous. And it will sometimes be very, very sore down there as well. Yeah, yeast is not fun. You also might experience pain during, penetrative sex as well. Redness for sure on the outside and in the vaginal walls. So during an exam, I, listen to the symptoms, the subjective symptoms that a patient's explaining to me. But then when I do my exam, if I see like that thick clumpy discharge along the walls or at, towards the back by the cervix, and it looks really red and irritated, I automatically know it's a yeast infection. And I'm a lot more, I don't want to say loose, but a lot more open to giving, a yeast medication, an antifungal, than giving an antibiotic. So if I see those symptoms right away, I'm giving something for that, because you're miserable when you have a yeast infection, a lot more miserable than when you have BV, I will tell you, because of the irritation and just the discomfort that you're feeling. So diagnostically, I will take a specimen and I will send it off to the lab, and they will look under the microscope and usually want to see mycelia, spores, or pseudohyphae. Your vaginal pH balance is usually not disrupted though, but what you will see, because it's inflammatory, unlike BV, you will see an increase in white blood cells. In regards to treatment, we always treat within the azole family, which is an antifungal. So whether it's fluconazole, turconazole, or clotrimazole, I would, one of the three I would recommend. Most people would probably know fluconazole as diflucan. You can take it in the pill form, or you can use a vaginal suppository, and where you would push the cream up there every night for 7 nights. So yeah, and I think that the cream helps a lot with like the initial irritation and whatnot, and we only give the cream in pregnancy. So in pregnancy, you can't take the oral diflucan. Of course, for my favorite part, let's talk about some preventative measures. So number one, I will say, is be mindful of the soaps that you're using down there. I know on the market today, a lot of soaps will say, oh, we're for sensitive skin and sensitive vaginal area. But if they still have chemicals, they're gonna throw off your pH as well. So I always advocate for water washing your vaginal area, but I know a lot of people are just not about that life. So you definitely want to use something that is really on the natural side as much as possible. And you don't need to be getting the soap like in your vaginal hole and all of that. Your vagina is a self-cleaning agent, and discharge coming out is a way of your vagina cleaning itself as well. So also you want to stay away from douching. You want to be wearing cotton underwear all the time. Gone are the days of wearing lace underwear or lace thongs all the time. You can throw that on for when, it's your sexy time. But other than that, I definitely recommend staying away from that and wearing a full underwear that's made of 100% cotton. That will help to ward off like moisture buildup, because bacteria feeds on moisture. Bacteria feeds on sugar. That's why I was saying earlier, uncontrolled diabetes causes a lot of yeast infections. So really, really, really try to limit, if not cut out, all processed sugar. and you really want to focus on more of a whole food diet as well. Stay away from wearing tight pants, and you always want to shower right after you exercise. But all in all, that probiotic, like I said, for BV will definitely help you. So yeah, all in all, guys, you can see that the main essence of what I'm saying is all about keeping your vaginal biome in balance. So it really comes down to lifestyle, what we do on a daily, the foods that we're eating, you know, the clothes that we're wearing, and the daily practices that we do. So keep that in mind, and I really hope that this video helped you. And if you have any questions, please feel free to leave them down below. Until my next video, guys, peace and love. See you later.